If the number of doctor's appointments that your loved one goes to seems to be multiplying like rabbits, then you'd probably think I'm crazy to suggest that they might need another. Let me tell you why it's not as crazy as it sounds. Hi, I'm Jennifer Miller with Aging Parent Toolbox, registered nurse by day and daughter of aging parent. The next appointment that the older adult in your life should be considering is with a geriatrician. A geriatrician is a medical doctor that has specialized training in the conditions affecting adults older than 65. Not to be confused with a gerontologist. A gerontologist also has specialized knowledge of the aging population. They may often participate in research and support the treatment plans of a geriatrician. But a gerontologist is not a medical doctor. So what can you expect at an appointment with a geriatrician? A lot. First, more time dedicated to the appointment that will cover a variety of conditions that affect the older adult, that quite frankly, most doctors just don't have the time or the specialized knowledge to address. In addition to any immediate medical care issues, the geriatrician can focus on the following. They can conduct a cognitive health assessment, especially if there are concerns about memory loss, and they will be able to identify early signs of dementia. They can address balance and stability issues, including fall risk assessment and functional ability, nutritional assessment and counseling. You can expect a lifestyle assessment where the doctor will address personal safety, stress management, fitness, tobacco, and alcohol use. The goal is to strive for a healthy lifestyle with maximum quality throughout this stage of life. One of the key areas where a geriatrician is beneficial has to do with reviewing of medications. A geriatrician has specialized knowledge in how medications interact and are metabolized in the older adult. It's not uncommon as people age to have medications that suddenly act differently, even though they may have taken them for many years. There may be an increase in side effects. They may become less effective. There's often a change in metabolism in the way that medications are absorbed. And there's some medications that are not recommended as people get older. The American Geriatric Society puts together a list of potentially inappropriate medications for the elderly. It's known as the Beers criteria. It's updated frequently based on the latest evidence-based research. The Beers list contains guidelines for medical professionals to help improve the safety of prescribing medications to adults older than 65. Geriatricians stay on top of this information so they can best treat their patients. And with the specialized knowledge that they possess, they'll be able to determine whether this is still a good combination of medications for a patient to be taking. They can conduct a behavioral health assessment, screening for depression and anxiety, and looking for any risk factors that may exist. These conditions are not uncommon in the older population, but they often go undiagnosed or without being treated. Now, a geriatrician won't necessarily eliminate the need for other specialists, but they act as an overseer and coordinator of the care being given to a patient. Now, suggesting another doctor to your loved one may result in some resistance, especially if it's someone that they've seen for many years. They may say, I've had the same doctor for 30 years. He knows me so well, I'd feel bad about leaving. But think about it this way. A new baby goes to see a pediatrician because of the specialized knowledge that they have about children. When that same baby is 30 years old, they're still not seeing the same pediatrician. The same thing holds true for older adults. It also doesn't mean that they have to ditch their primary care provider right away either. But it is worth seeking out the advice of a geriatrician, especially if your loved one is experiencing any conditions that are associated with older age, including memory issues, incontinence, osteoporosis. it's worth getting an additional opinion. So first, see if there are any geriatricians available in your area. It's a specialty that has seen increased demand as the population is getting older. Don't be surprised if there's a wait to be seen. So get your loved one in for an appointment, see what they have to offer, and see if it's a good fit. Subscribe below to this channel where I will be bringing you more information and resources to help you navigate the winding road of the golden years with your aging loved one.